my name is Eli Neal, and today my dad, Dr. Neal, is going to be performing a cataract surgery. I will be narrating live exactly what's happening so you can understand. We can have some fun. So first things first, he's now doing something called a capsulorhexis. A capsulorhexis is where you take some tweezers, you take the film covering the eye cataract, and you take it off like that. You grab onto the skin and you just peel it off slowly. Kind of like tape on a desk. That almost hit me in the eye. It's a good thing I'm in the eye now. Speaking of eyes, earlier my contacts were bothering me, so I asked around if they were to see if there were any lubricating eye drops and stuff for my eyes. Right now he's doing the hydrosection, and there weren't any lubricating eye drops in the office here where they're doing the surgery, 20 feet away, over there. I mean, what? They don't have lubricating eye drops. What if the patient's eyes are dry? For them. But it was a little confusing, but they said we had some over there, and they pointed to the building across the street. I was like, the video's starting in a minute. I can't exactly do that. So, I didn't. I'll manage. So right now, we are in case number 8 of the day. Right eye, platinum case. And it's a normal cataract surgery. We only have 18 cases today, meaning we've already gotten through just about half of them. There's one more and then we're halfway through. And it's only 10 a.m. We started at 8. So that would mean, estimating, since the last case is going to take an extra hour, we should be done around lunchtime-ish. It's 1 or 2-ish. So right now, he's now using a little tool called a phaco handpiece to vacuum out the cataract. He's using it to kind of sculpt the groove through the center, and then he's going to use a separate tool to break the piece apart. You'll see soon while he does it. He's doing that so he can take out each piece individually without them sticking to each other. Simple. Once he's done this, I'll just kind of be quiet. I'll narrate while it's happening. So now, as you can see, he's broken apart each piece and he started phacoing. He switched the mode of the phaco handpiece to a different mode. It's vacuum mode now. So now it's going to try to eat the entire thing. As you can see, it fits down that tiny nozzle. I don't even know how it does that, but it does. You know who's getting a surgery today? My grandpa. He's not on this list, but he's taking a nap in my dad's office because he's fun that way right now. But he will be, I might not be recording it, but I'm going to try to. I'm going to ask my dad if I can. Right now, he has just finished the half, and he's about to finish all the way. Okay, he's now all the way finished. He's going to use a little syringe filled with something called viscoelastic, and as the name suggests, it's kind of viscous. It's used to make the eye keep its shape and to kind of blow stuff out of the way. So as you can see, you can kind of, if you look in close, you can see the membrane is moving while he's blowing it away. And yeah. Now he's injecting the lens. Okay, since this is a platinum case, never mind, it has a different type of lens. This is case number 8 of the day, I think. I'm just going to double check just to make sure. He's now going to be doing something called polishing. They're both the same type of case, so even if this is the wrong one, it should still work. I'll reload the page and just check. Oh, sorry. I apologize. This is number 7 of the day. I'm really sorry about that. That was a mess up on my part. Wait a minute. Now it says number 7. I thought I switched it to number 8. So if you're watching this and it says number 7, I guess it just didn't register my change. But if you're watching this and you're number 8 and it says number 8 on there for you, this is not your right video. Your video is the next one. But I believe everything is going perfectly. We're about 5 minutes into the surgery here. And he's still polishing. Polishing, I forgot to explain, sorry. It's where he's wiping the lens. He's wiping the lens to wipe off any extra cells that might be clinging to the lens. I did this in the last video, but I kind of hurt my hand doing it. I poured Tax on my hand, which already you can tell is a bad idea. And I was like, so imagine this is the tool he's using. I used a pen and I wiped Tax off my hand into the tack container. And I said, imagine the cells are the Tax. So he's wiping off all the cells that are clinging to the lens back into the capsule. Okay? Looks like he's just about done, so now he's going to be injecting a sealant into the eye to make sure it's all waterproof before he's done. Obviously, because he doesn't want it to leak or anything.
I know it's because your mouth.
No, actually,
He's now checking if it's watertight. If it's not, he'll inject a little bit more. Okay, it wasn't quite watertight, so he's injecting just a tiny bit more. And he's injecting the final shot. If you did enjoy this, go ahead and leave a like and subscribe to the channel. It shows your support and helps us reach our goal of 1,000 subscribers. If you didn't, leave some feedback on what we could do better next time. I love your guys' feedback. It really helps out. And we're just about done here. So I'd like to thank you for watching again. And we'll see you guys when he starts the next surgery. Depends on if he has a yak in between. Thank you again. Bye.